William Vargo here at the Wilshire Chiropractic Institute in Los Angeles, California. And I'm here to show you how the Triton DTS is used for spinal decompression on somebody's neck. When somebody is having a disc issue in their neck, quite often it will compress upon nerves, and the person may feel a pain in this area. They may feel pain all the way down their arm. They may wake up in the morning with a weirdo pin and needle feeling in their fingers, or if they take a long drive, they might feel that weird feeling in their hands and stuff. It's a kind of a numbness kind of thing, feeling like your hand fell asleep, if you will. The Triton DTS can be used on the neck, can also be used on the low back. There's a term called sciatica pain, which is where nerves back here can get squeezed on or stretched on by a herniated disc, a bulging out disc, and cause a pain that could go into the butt muscle or down the leg to the knee or even all the way to the floor. Other similar kind of things. Feel like my leg fell asleep, feel like my foot fell asleep. When your foot falls asleep once in a blue moon, you're not really giving any thought, but if it's fallen asleep often, on a daily basis or something, you give it a lot more thought, because it also becomes weaker and weaker as that kind of thing goes on. A lot of people suffer from grief in their neck. This is very good for that kind of thing, as we are going to demonstrate for you now. Assume the position. I want you to lay on your back. I want you to stick your shoulders here. Look here. I want your shoulders here. I want your neck here. I want your head up here. Okay? Okay, what this does is it distracts and decompresses the neck. So if the neck is being compressed, the disc can bulge out. Okay, and then when it's decompressed, suck it back in off of the nerve. This headband here is to hold the head in place. There's a cable attached from the computerized device up here that provides the traction and decompression. And the cable attaches to this item here, enabling this kind of thing to happen. So she's in a comfortable position. We're going to turn the machine on. This lasts for about 14 minutes. During that time, it will go through a series of stretch, relax, stretch, relax. And by the end of the time, she should feel noticeably different than she does now, which we'll ask her about at that time. Okay, and we're starting. Okay, this is completed. Takes about 14 minutes. It's pretty easy to get out of. Take that there. Over here, take the knee things out of the way. And go ahead and sit up. Did that hurt?
No.
Did you fall asleep?
Yeah.
Yeah, it's not unusual.